Thank you for this opportunity. I want first to, on behalf of myself and on behalf of the people of Vihiga, to most sincerely thank Capricorn for working with us on programs dealing with community health. And for the last 3 years we have worked together. We have managed to achieve a lot. And one of the main milestones of this program has been involvement of the communities in identifying and getting solutions on community health challenges. So in that, I would say we have done extremely well. And through mobilization, we've been able to have evidence on a number of challenges under the community healthcare program. And some of the programs we have had which have had a major impact are mother and maternal care programs, mortality issues in terms of pregnancy, where we have had through this program, we have had reduction in mortality rates. We have also been able to work on the issue of nutrition. Nutrition is a very important aspect of healthcare system, which normally is underrated or not considered. But under this program, we have been able to deal with a lot of programs dealing with nutrition. And I would like to say that as of now, people in Vihiga are very conscious and aware of the role of nutrition as regards to healthcare system, and particularly for mothers, the pregnant mothers, and mothers who have newborn children. That has made a lot of difference. The other area of interest which we have worked on is the issue of coming up with the policies and legislation that is crucial to deal with the community health programs. Through this program or our partnership with Capricorn, we've been able to come up with a number of legislations. Among them, as I've said earlier, nutrition program policy. We are currently we have already completed the nutrition bill, and we have other programs or other policies that we are working on, like we are even working on FIF policy and the legislation. So all these have been able to be achieved through involvement of the people at the grassroots, have been informed. And that's what we are saying, evidence-based or evidence-informed policies. Because most of the policies that are crafted at the higher level, let's say at the headquarter level, without involving the people, when it comes to implementation, normally it's usually a challenge. But those that are community-based usually address the issues as collected from the ground. So based on our experience with our partner Capricorn, there are a number of things that we have achieved, and among them is the establishment of stakeholder forums at the community level to be able to deal with the various health issues. We have also had the promotion of multi-sectoral collaboration, bringing all the sectors in the health bringing all the sectors to deal with health issues. We will bring in the health people, the education, the finance, social services. So we bring everybody on board. And the approach here has been and remains building from the ground upwards, or bottom-up approach. Start with the communities and move forward. The other is fostering trust, because healthcare issues, there's a lot of challenges and trust that need to be built. So when you when you start at the community level, the trust is built, and once the trust is built, then acceptance comes in, and therefore the chance to succeed becomes even much higher. And then other areas is coming up with the long-term programs, whereby some of these programs you have started, they are just not a short-term program because there is a funding. They are programs that we as a county, those we started under this partnership, we are continuing with them. These programs have now become part of our activities in executing. We are budgeting for them, and therefore they become sustainable. Because quite a number of programs, they start, and when the donor funding or the partner leaves, the program collapses. For us, through this long-term engagement, the program has become part of us. And the other aspect is peer learning. By us coming up with the programs or working together, we create a forum for other counties, other agencies, other people to come and be able to see where we are, what we have done and what we are doing. And I'm happy to report that Vihiga, we have done very well. And we believe what we have done, we can have many other counties coming for peer learning and being able to understand or learn what we have done. Finally, I want to talk about the issue of HPV vaccination and cervical cancer prevention. This is a very, very, very important aspect that has brought in a lot of challenges and so on, but with science and technology, a lot has happened, particularly on HPV vaccination. Initially, the science indicated that you needed two vaccinations, but through science and innovation, now you can only have one vaccination, which ensures that the young people, the young girls, can be immunized from the HPV ailment or the issue which deals with the cervical cancer issues. So I would like to say that here in Vihiga, we have done extremely well on HPV screening. We have already screened one county, that's Luanda County. We have done 100% screening, and the approach that has been given has been where you deal with the people at the household level. Even the collection of the samples are done by the patient or by the client herself, and we have had a chance where we have had even the analysis has been done through mobile laboratory, and the experience has shown that this has a major impact. And moving forward, I think we want to work together with the Capricorn and the government, national government, and all agencies to promote now the program that will launch, a long-term program to carry out HPV vaccination for our girls, so that in future we can deal or be able to eliminate the cervical cancer, which is a major threat to our lives and particularly to our reproductive systems and general healthcare system that we aspire to promote and have healthy people, so that we can use the healthy people to build a strong economy and have better and prosperous county and country.